everyone, I wanted to hop back on here and just leave a few words of, not really wisdom, just words of encouragement, because I think just on this topic I've been kind of stuck on, and just the customer service in the healthcare sector and how things have really taken a bit of a nosedive. They really have. And I'm sorry again, I'm driving, so it's always a little bumpy and shaky. I am not a YouTuber. I'm not a professional. I'm just a person on the internet that's driving and has something to say. But the more I got to thinking about healthcare and customer service and how things have really not been very good, I had an interaction with a patient today at my work where they were automatically dismissed and told that a certain prescription for a certain thing that their child needed was automatically dismissed. And there was absolutely no questioning. There was not even the offer to look at what the doctor had sent over. I don't want to talk too much about specifics, but, you know, basically they were just automatically dismissed and told, nope, you have to go back to your doctor. We're going to need XYZ. That will not satisfy what we need. It made me feel exactly what that person felt. That parent with that child that had specific medical needs for a specific product, they were just automatically dismissed by one of the people I work with. And I don't understand why they would do that and not even at least look into it. The thing is, I think, and again, forgive me, I think I was tired my first video on this series of customer service in healthcare. The point I was trying to develop a little bit better was, a lot of the time, I think what is upsetting in any customer service interaction is not being heard, and also not feeling heard, not having your concerns, your needs mirrored, reflected, and repeated to you. A lot of times too, and this has happened with myself when I've gone to different doctor's offices and things, the other person, the provider or the nurse, I'm sorry, this is shaky, they're so busy charting and typing and everything, they really don't communicate well. It's something I am trying to work on myself. I'm not a doctor or a nurse, but I do work in kind of counseling, and I think it's important because I've experienced it. And I thought, maybe God, if you don't mind me getting too personal or theological, I think God teaches us lessons in unique ways. And I thought maybe I went through this or experienced this kind of bad experience, went through this annoying, frustrating situation with my surgery not being scheduled properly and showing up to the hospital, and no, we don't have any idea what you're here for. Sorry, let's go back to the drawing board. Joke's on you. I don't know. It definitely opened my eyes, and if I could be an advocate for patient treatment and how we are spoken to as patients, I want to be that person. I think it's very important because, again, I had a situation where the patient was really upset to the point of tears, and she said, you don't understand how difficult this is for me. I brought everything from the doctor. This is what they gave me. Don't you understand? She said, I was just immediately told, no, you have to go back. I need blank, blank, blank. Where in the letter, it was a typed letter from a medical provider, and the person said, no, that's not good enough. I can't accept it. It was totally acceptable, at least for the time being. We can go back to the provider and we can get what we need in specifics for future months. But for this month, to get her in and out the door and into the drugstore and the store and get the things that she needs, it was fine. It was totally satisfactory. And I stopped charting when I was talking to her, when she was revealing this to me, She said, I'm sorry, but I want to talk to you about the prescription I had, because I just had a really bad experience with the person that was just in here. And I said, my gosh, I'm very sorry. Tell me what happened. She told me. And I, instead of just charting, because I do have a lot to do, I have certain things in the chart I need to take care of and move on to the next patient. But at that moment, when they're vulnerable and they are expressing concern, it was important that I turned my body away from the computer and my eyes toward her and gave her eye contact. That, if nothing else, communicates compassion and respect and interest in what is being said. I am a communications minor, and that communication is so important. Not just how we say, but the way it's encoded. All the things, not just the delivery. You could say the words yes or no, but it's our facial movements, it's our tone, it's our body posturing, it's all these different things, it's attitude. It's all these things that kind of add a little seasoning to what we're saying. That can be for the good, or it also could be for the bad. I was just thinking a little more clearly, so not to be redundant. I just wanted to talk about that a little more. It was on my heart, and it's something I'm putting into action. I don't know if I'll do what I'm doing for a living for the rest of my life, but in every customer service interaction, that is important. It is unanimously important. Stop what you're doing. Tell them, that must have been very upsetting for you. I am very sorry that this has happened to you. This is what we're going to do. How can I make this right? That's what a person wants to hear. Not a patient, not a client, not a customer, a person. A person. That's what you want to hear. If you've ever been treated poorly in any customer service interaction, that's how I think most of the time these feelings develop. Is I was talking to the person at the desk or the person that called, and I could tell they were not listening to what I was saying. That is not acceptable, and I think that across the board in all forms of healthcare, especially, because there is that element of vulnerability. It's like, look, I'm not well. My child is not well. My spouse is not well. I need your help. That level of vulnerability should be taken with a grain of salt. It's like, hey, let's dial back and let's give a little more attention to how we communicate. So important. But let me know down below what is important to you guys in terms of customer service, how you are treated when you go to the dentist and doctor's offices, or public health programs and different things. How do people treat you? How could things be improved? What's going really good? What could be improved? I would love to know your thoughts. So thank y'all so much for watching. I appreciate your time, and y'all take care and stay safe and healthy.